It's a collection of different, it's very complex neurodevelopmental disorder. It affects communication and behavior, and it usually starts in the first 2 years of life. I have a couple of people that I know that were not diagnosed until much later because of the functioning. The wonderful or unwonderful thing about autism spectrum disorder is that it is a spectrum. So that we have this huge, big range of what we see in symptoms. So your DSM-5 is on box 30.11 on page 448 that talks about ASD and defines it for you. It does cause significant impairment in social interactions. It can, in communication, you can see repetitive stereotyped behaviors, interest activities. I don't know about you younger people, but if you want to watch a movie that will teach you a lot about autism, then it's Rain Man with Dustin Hoffman and what's his name? Cutie that plays in all the Mission Impossible.
Yes, Tom Cruise.
Tom Cruise. Yeah, Tom Cruise. And Dustin Hoffman does an excellent job. So he is a high functioning autistic person. We have some kids who are nonverbal that just don't look like they're connected to the world at all. I know one young woman who was diagnosed when she was 12 on the spectrum. I have another young man that if you were to talk to him and be around him, you would never think he is on the spectrum at all. And he was diagnosed at like 16. So Temple Grandin, if you know that name at all, she is a professor of animal science at the Colorado State University, who is significantly autistic and has written several books. And if you get a chance to read any of her stuff, she describes what life is like from the inside, trying to help people understand who are not autistic what it is like to be autistic. So if you've got time to do that and find it interesting, pick up something from her and read on it. This is not a one definition fits all kind of thing. You see the severity that varies, and that's in box 30.10 in your book. So some of the issues that you're going to see with this are some physical issues, sleep problems. These kids don't sleep well. They may have issues with diarrhea, constipation, abdominal pain, irritability. Most of them have learning disabilities of some shape or fashion, anywhere from 35 to 50%. I got to move something because I can't see and I don't have this printed out. So give me just a second. I got to move this bar. Yeah, I'm going to move it up. As far as we have anxieties and phobia, depression, OCD, ADHD, a lot of our autistic kids have ADHD, very disruptive behaviors. Some of them have seizure disorders. I guess there's another high functioning autistic TV show with The Doctor, where he is a young surgeon, yes, that's got autism, and he does a very excellent job of displaying what autism is like. So I have some autistic patients. I have one that will talk to me all the time. She has seizure disorder, and she's one of the ones I talked about earlier, that when she gets sick, her increase with an infection, she will increasing her seizures, but she really doesn't comprehend that she's sick. These kids have major social interactions. Sometimes they have a real unusual way of relating to people. Sometimes the signs can be noticed in infancy. And some of those can be colicky, they can be difficult baby, but just because they have those kinds of things as a baby doesn't mean that they have ASD. So you got to be really careful when you start reading things and parents start reading things and they want to talk to you about that. A lot of times, most of our parents really start noticing symptoms when there is a delay in the language. So somewhere between 15 months and 2.5, kids really start exploding with languages. And one of the questions I ask at those, how many words have we got? I start asking that at the 12-month checkup. How many words do we have? At that point, we should have maybe mama and daddy specific, maybe something for baba or eat, some kind of something. The sad thing is sometimes we'll have words and then they'll come in the next time and say, well, he was saying all these words and all of a sudden we stopped. Or we're not saying those words anymore. That should be a huge red flag that we've got that autism is something we need to be looking at. So this is in box 3012. These are your red flags. Social, if you've got, they lack a social smile, they won't respond to their name, they don't point to an object, they won't play pretend, they avoid eye contact, they want to play alone, they don't want to be around other people, gives unrelated answers to questions, they're just talking nonsense, any loss of any social abilities at any age. Language, oh my gosh. Sometimes you'll think that parents will get all excited because everything that the kid says, no matter what, they will repeat it. That's called echolalia. That is not necessarily a good sign. If they're just repeating what mother says, or they do it, especially echolalia with monotone, or if they sound like they're reading from a script, not without any inflection or anything, that is a really good sign that we may need to be looking for autism. A lot of these kids thrive on structure, so they may get very upset over the slightest changes in their daily routine. If you've ever heard about the flapping hands, that can be, or if they rock all the time. Sometimes they will have unusual responses to sensory stimuli. A lot of my autistic kids, when I go to look in their ears, they absolutely freak out. And it's not because I'm being mean or hard. It's just that the touch of the ear absolutely is like sticking them with a knife. A lot of times these kids will, and not because they intend to, but they will engage in self-injuring behaviors like head banging, or pinching. I have one that knows exactly how much skin to get and can pinch just enough. And there've been many times I've come out of that room with new bruises because she has pinched me while I'm doing her exam so many times that I've got new bruises. But I'm her care provider, and I know that she can't help it. My mom keeps apologizing. I said, well, it's not your fault and it's not her fault. So, and I'm okay with that. I do quietly remonstrate her. It's like, we really don't need to pinch. That hurt me. Those kinds of quiet, basic. And then she'll say, I'm sorry. And then she'll go, psych. But that's her response to everything. She'll always end up with psych. It's like, okay. But again, those inappropriate responses to questions. So we screen for ASD, again, more screening tools. We screen for ASD at 18 and 24 months. That's what the AAP recommends, and that's pretty much the standard. The most commonly used screening tool is the MCHAT, the Modified Checklist for Autism in Toddlers. It does come in a Hispanic version. Actually, it comes in several different language versions, but Hispanic is one I'm going to use most in my practice because that's what most of the time my other language is besides English. And that is a common, like a public domain kind of thing. So you can look that up and pull that off. It's on Blackboard, the boss says. So, well, she is in this class. Now, if you are a trained autism screener, the gold standard for diagnosis is the Autism Diagnostic Observation Schedule. It's supposed to be scheduled, not schedule, second edition, ADOS2, but it requires training to administer. So we have recently learned that we've got several new people in town. We used to just have a couple of places that could do diagnosing or do a diagnostic testing for our kids with suspected autism. We've gained 2 or 3 other people in town, which has just been huge, because nobody in the outside areas has that. So we've got people here in town screening for a broad range in the area of kids. So other tools are listed down there: the CAST, the Childhood Autism Screen Test, and the Social Communication Questionnaire. And a couple of semesters ago, Dr. Liz Sternberg, who is one of our developmental pediatricians in town that does do developmental screening, gave us a whole list. And you've got this now on Blackboard, or you will be. Okay. So Dr. Blankenship will be putting that. There's a whole list of things. This is, it's called the Autism Spectrum Screening Questionnaire, which is another one that is used for routine screening and probably used in older children besides the 18-month and 24-month. That's the one at the bottom, the ASSQ that I just held up, and she's got that, and she'll make sure that it's posted. And we can use that, again, that's for ages 7 to 16, and we can use that in our older kids if we feel like there's a potential for autism, and that if we want to do a screening tool before we refer them for that. So, management. What are we going to do? Any child who fails the screening, we're going to send for referral. Any developmental screening, be it our ASQs that we do, or if they fail the MCHAT, or the ASSQ, or anything else that we're doing, we're going to send them for a full screening, for a full diagnostic workup. And any child who is displaying those red flags that we talked about, you don't necessarily have to do a screening tool on them. If they've got enough of those red flags, you just send them on for a full workup. There is a process to getting set up for a school for a full screening, because a lot of times there is a whole packet of information that the assessing provider will send to the family, and that has to be all filled out and sent back to the screener before they will bring them in to do an actual screening. So I explain that to my parents, that's going to have to be done, and they're not going to move forward until you get it all done and get back to them. So once we get a child actually diagnosed with ASD, then the work of managing their ASD begins, because it is a chronic condition and there's nothing that we're going to do that's going to make it any better. We can't fix it. All we can do is work with it. We've got to support that parent, because a lot of times they're in denial until they actually get the diagnosis. And so we've got to be there to help them through the grief process, because it's just like with any other kind of chronic condition, a lot of their hopes and dreams go out the door when they get a child that's been diagnosed with autism. So our job is to help coordinate with some of the following therapies. ABA therapy is very specific. It's development of socially appropriate behaviors while decreasing challenging behaviors. So our autistic kids need to be in ABA therapy, and there's only a few here. There's only just a very few that actually are trained and licensed to do ABA therapy. So sometimes there's a wait list to get in for that. These kids are going to need OT because of sensory processing, and they're going to focus on, in OT, they're going to focus on the biggest issues that they have with sensory. And that can a lot of times be food, and we're going to talk about that. Physical therapy, speech. Remember, these are kids that's the first sign that most parents is that there's lack of speech or a regression in speech. Nutritionists, these kids have a tendency to be very picky, or textures. They're very, very sensitive to textures. So a lot of these kids are doing food therapy. At school, they're going to need an IEP, because we have to have an adaptive school environment to meet this child's particular needs. And as we've already talked about, there can be comorbidities of ADHD, OCD, anxiety, depression, aggression, seizures. And a lot of these kids are on medications to help manage those things. Has nothing to do with their ASD, except they just happen to be comorbidities. So really not, there's no pharmacology for ASD. It's the symptoms and things that go along with it that we end up using medication for. And that is, oh, it is 4:45 and I'm done. Is that not perfect timing or what? Perfect timing. Questions from anybody? Y'all been so attentive. Well, I have run my mouth all afternoon. I wish I could have gotten to know you all. I think we'd have had a great time interacting in class. I'd have loved to have been able to bounce things off of you all. I'm going to shut up and let Dr. Blankenship finish up her announcements. I'm done. Oh, you're done with your announcements? Okay, very good. Well, then I'm going to let her sign off then. I'm going to get up and move.
Does anybody have any questions? I know you're tired. Elizabeth's exhausted. So if you have any questions, please send me an email. I will do a summary announcement of the things that we talked about. We have one or two people that weren't able to be with us today. I will take this video and make it into snippets based on the PowerPoint, so it's not one long one should you want to listen to it anymore. And if I add any more documents into Blackboard, I will also include that in the PowerPoint. So if we have no questions, thank you so much for your time. We appreciate it. I know the next couple of weeks are going to be busy, but just keep the nose to the grindstone and take baby steps. As Elizabeth said, the only way to eat the elephant is one bite at a time. So go take a break for tonight and get some supper and spend a little bit of time with your family. Thank you. Bye-bye.